Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeopathic Remedies for Chronic Obstructive Pulmonary Disease, popularly called COPD, and this particular term I will use throughout the video. What is COPD? Chronic Obstructive Pulmonary Disease is a composite term signifying a life-threatening disease state of human lungs, where irreversible changes occur in bronchioles and alveoli, leading to almost malignancy. To be more specific, chronic bronchitis and emphysema conjointly produce this sad state of affairs. Please look the images given behind. Particularly what happened here, first phase is this mucus filled bronchioles. The bronchioles fine tubes supplying oxygen to the lung pulmons are obstructed with heavily thick mucus, and finally due to this condition the alveoli at the terminal end of these bronchioles are damaged severely to a state of irreversibility. It will not reverse. Complete damage of the alveoli. So if the alveoli is damaged, there will be no inflating and emptying. Actually, during the process of respiration, when oxygen comes in the lung, these alveoli are inflated, and when we expire, these are contracted. This will stop. They will just be rigid, and gradually they will be simply destroying. So the man will suffer from extreme pain, agony, and finally, unless it is stopped, he may die even. Symptoms are given here, but I will also refer to this in next step. What causes COPD? Number one, smoking. Physicians refer to this problem heavily. Smoking and second-hand smoking. Fumes, pollution, asthma. These are comes later. What are the early signs of COPD? Chronic cough, copious mucus production in chest, shortness of breath and tiredness. What are the signs of COPD getting worse? Coughing becomes stronger, frequency increased, going out of breath from normal work, producing more sputum of darker color, being more tired than usual, unusual insomnia, confused state waking from sleep. Confused state waking from sleep comes when there is less supply of oxygen in the brain. Now, due to the COPD condition, air is less in the lung, so there will be less in the blood as well as in the brain. Oxygen saturation level going below 90%. When to consider doctor? If any two symptoms of getting worse recur 3 times, contact doctor immediately. On the right side, just note the yellow board. Please remember, changes brought about by COPD are irreversible. Further damage is arrestable, but it cannot be cured altogether. You cannot go back, but you can stop it there. If you can stop it there, then it will be better for the patient. The damage is arrestable, but it cannot be cured or reversed altogether. How to prevent COPD? Number 1, quitting smoking or never starting smoking. Number 3, avoiding second-hand smoking. Number 3, using protective gears while working with chemicals, fume, dust. Since these also cause COPD, so this protection you can take if you work with these things. Controlling stress, meditation, relaxation, chatting, etc. Getting regular exercise to strengthen lung capacity. Getting regular vaccination against pneumonia, influenza related virus, because this thing complicate the situation. Number 7, get enough lung friendly items like beet greens, apples, blueberry, pumpkin, turmeric, tomato, red cabbage, olive oil, yogurt, Brazil nut, lentils, etc. And most of these are fresh vegetables full of antioxidants. You know, the antioxidant gives heavy resistance to chronic inflammation, and COPD is of course a chronic inflammation, chronic inflammatory disease. Ambrosia for COPD, that is, we are coming to remedies. Ambrosia for COPD, excited by violent tickling, evening without, not in the evening, morning with expectoration, generally of greyish white, seldom of yellow mucus with sour salty taste, paroxysm of cough coming from deep in the chest, worse from exertion and music, violent spasmodic cough with frequent eructations and hoarseness in aged people. Arsenicum album for COPD, chronic bronchitis of old people, dry catarrh of old origin from emphysema and pulmonary congestion. Dyspnea continues during intervals of cough, returns periodically. This periodic nature of returning is a key symptom of arsenic. Periodic nature. You ask, the patient will report you, sir, in every winter or in every say autumn, I will suffer from this. Then you will certainly think of arsenic, especially at night. Expectoration, white, frothy, often sticky mucus, worse after eating, in the afternoon, after midnight, from lying down, drinking cold water, and mental exertion. Nitrate cough for COPD. Cough excited by coming into a warm room with salty, purulent, greenish sputa. Cough short, rattling in chest with rumbling and incarcerated flatus. Incarcerated means the wind, flatus means wind, the wind which is not going upward or not going downward. This is incarcerated flatus. Sulfur for COPD. Inveterate bronchitis, chronic catarrh with secretion of large quantities of tenacious mucus, suffocation with palpitations, pain in chest during cough with nausea and vomiting, heaviness in chest, dim vision, sensation of ice in chest. Whenever chilled or perspiration is checked, that is when these two, either chilled or perspiration is checked, the problem comes. Standing is the worst position for sulfur patient. Burning sensation in the body, sulfur patient. Grape, sweet, alcohol, beer, acid. Sulfur patient, averse to meat, sulfur patient. These are general symptoms. Last few points are general symptoms. The most important symptom to pinpoint sulfur patient. Phosphorus in COPD, subacute attacks of bronchitis in emaciated cachectic. Cachectic means very thin. Overgrown young invalids. Dry tickling cough in evening with tightness across chest, expectoration in morning. Pain in chest when coughing, relieved by external pressure. Tingling, soreness, rawness in air passage with expectoration of viscid or bloody mucus. They crave cold things like ice cream, cold drinks, etc. They are apathetic and indifferent to friends. This is the nature of phosphorus. Phosphorus patients are very much apathetic and indifferent to friends. Carbohydrates for COPD, chronic bronchitis with emphysema, great anxiety and dyspnea but no restlessness. Another peculiar symptom, great anxiety, dyspnea but no restlessness. It's a very contrasting symptom. Cough in violent spells, watery profuse discharge, breathing short with cold hands and feet, cold breath, cyanosis, feel better from hard fanning over face, want clothing loose around waist. These symptoms are general symptom of carbohydrates. Opium for COPD, suffocative attacks during sleep, like nightmare, short inspiration, long, slow expiration. Epigastrium drawn in, great anguish, fear of suffocation, sopor, bluish face as if going to die, Worse from smoking or wine, better from cold air and bending forward. I have given a image of 9 quadrants of the abdomen below. Please check it. Epigastrium is there. You please find it out. It is there. That place is which place is epigastrium? You please find out. Seneca for COPD, operation in chest, pain appears superficial as if in pleura. Sensation of chest being too narrow to desire to enlarge it by taking a deep breath. Kalium carb for COPD must lean forward with head on table, feeling as if there were no air in chest. Worse from drinking motion. Dyspnea worse at night with strong beat of heart, loss of appetite and vomiting. Chronically suffers from backache, weakness and sweat. These 3 symptoms are key symptoms of Kali carb rather. Backache, weakness, sweat. If these 3 musketeers are there in a particular patient, you can think of Kali carb. This is said by great Dr. Farrington. Sepia for COPD. Operation in chest. Dyspnea when walking. Flame appears to be loose enough but cannot be raised by coughing. Worse during rest. Lying on left side from acid drinks. Dyspnea worse from sitting, better from dancing and walking rapidly. Note the peculiar symptom. Dyspnea worse from sitting, better from dancing and walking rapidly. With this the video ends. Thanks for listening and viewing. Please, if you feel any trouble, write down in the comment section. I will certainly respond.